Before adding medication to an IV fluid container, review the physician's order and prepare the prescribed medication, as shown in the video skill, preparing an injection from an ampule or preparing an injection from a vial. Confirm that the medication to be injected is compatible with the existing IV solution. If it is not compatible, be sure to use new tubing. Be sure to have another licensed person confirm the medication to be added if required by facility policy. To add medication to a new container, locate the container's medication injection port or site and wipe it with an alcohol swab or an antiseptic swab. Do not use the port for IV tubing insertion or the air vent. Inject the medication through the injection port of the IV bag. After injecting all of the medication, withdraw the syringe. Then gently turn the bag or bottle from end to end to mix the medication and IV solution. Next, complete the medication label with the name and dose of the medication, the date and time, and your initials. Apply the label on the container. If needed, also apply a time tape that identifies the time when the solution was hung and when specific fluid levels should be reached.
Can I see your ID band?
At the bedside, verify the patient's identity according to facility policy and explain the IV medication to him.
I've got some medication we're going to put through your IV line, so I'm going to get that started, and if it causes any discomfort in your wrist or anywhere, please let me know.
Okay.
Confirm that you have the correct medication for this patient. Hang the bag. Then spike the container with the IV tubing. Prime the tubing if needed. And regulate the infusion to the ordered rate. To add medication to an existing container, follow the same steps, but make sure the container has at least the minimum amount of solution needed to dilute the medication properly. Pause the pump or clamp the IV until ready to infuse. After injecting the medication via the injection port, remove the bag from the IV pole and invert it several times to ensure thorough mixing. This will prevent a bolus of medication from reaching the patient. Resume the IV infusion after the bag has been thoroughly agitated and labeled with the name and dose of medication, date and time, and your initials. As part of your follow-up care, assess the patient's IV site for signs of phlebitis.
Has your IV been hurting you at all?
No.
Okay, great.
And observe for adverse drug reactions, which can occur rapidly with IV medications.
I'm going to listen to your heart for a minute.